Maryland is making history in women's health. Governor Wes Moore just signed landmark legislation that requires mammogram patients be notified if their reports show breast arterial calcifications are detected, which makes Maryland the first state in the nation to mandate this information. Dr. Rachel Brem, co-founder and chief medical officer of the Brem Foundation and professor at George Washington University, joins us now. What does this new law do in Maryland, and what does this mean for thousands of women?
It is groundbreaking because the number one killer for women is cardiovascular disease. So this will allow us to know if a woman has an increased risk of having heart disease on a mammogram. No additional tests, no additional costs, and it's simply by seeing if there's any calcium deposits in the arteries on the mammogram.
I have to ask because it's interesting. We know that radiologists can already see these calcium deposits on those scans, but they haven't been required to tell patients until now. Why is that?
The data more recently has really been extremely strong in the correlation between these calcifications and cardiovascular disease. So we really didn't have that profound data that we do now. And the reason it's so exciting is because if a woman does know that she has these, it's actionable, right? She can take statins, she can get a CT scan to look at her coronary calcifications, she can change her lifestyle and exercise, see a preventive cardiologist. There's so many things that can really help a woman live and prevent cardiovascular disease by a test we already have.
You guys advocated for this law, but there was opposition to this from some radiologists. Why would anyone push back against this?
Well, it's perplexing to me as well, but the reason they give is that with this information, they don't know what to do. We don't yet have guidelines. We are working on developing these guidelines, exactly what a physician should do if their patient has these. But how can we deny women this important life-saving information that we have? And that's why the Brem Foundation was so strongly for this bill, helped write this bill. And I'm so grateful to Speaker of the House in Maryland, Jocelyn Pena-Melnick, who's been a strong advocate for women, who really helped us with this.
We know this law in Maryland goes into effect in October. Do you think other states could follow suit?
We are going to do everything we can at the Brem Foundation to make sure that's true. And we're going to start legislation on the national level as well. How can we deny women this life-saving information? So the hope and the belief is, yes, other states will follow soon.
All right. Dr. Rachel Brem from the Brem Foundation, thank you so much for joining us and for sharing your insight. We appreciate it.
Thank you.